and welcome to Your Health. And this is a topic that's of interest to all of us because we're always talking about the healthcare system. We have with us today Dr. Jewell Halanych, who is the director of a very long-standing program here. And I'm going to let you give, because this name is so important and I'll get it wrong. So tell me exactly.
So we are the UAB Internal Medicine Residency Program.
Okay. So what do you do, and how is this of interest to our folks that are watching this?
So the residency program is a program that trains almost 30 internal medicine residents every year.
Wow.
So we are what I would consider the cornerstone of the UAB Montgomery Medical Campus.
Gotcha.
So UAB up in Birmingham is the main campus, and it has 3 other campuses, one in Tuscaloosa, one in Huntsville, and now in Montgomery. So we have been a campus since 2012, which
Wow.
means we've been training medical students since 2012.
This is amazing.
Yeah,
We're so blessed.
Yeah, the residency program, though, goes back much further. Most people don't realize we've been here since 1974, and we've been a UAB program since 1978. So we've been here a long time.
Wow.
We've trained over 500 residents.
That's amazing, and I love it. You know, there are a lot of great things to do with healthcare that are right here in Montgomery that a lot of people really don't know about. And when we do this, I wanted to start off by letting people know, we'll get deeper when we do our next interview into what exactly you do. But when you say internal medicine, what does that encompass?
A lot of people don't really understand that. People understand what surgeons are,
Right.
what family medicine is, but internal medicine kind of is a mystery to people. So you can describe us as doctors for adults.
Okay.
That's what we do. So we're like family medicine, but we don't deliver babies or take care of kids. We are the cornerstone of adult medicine.
Does that encompass every kind of adult medicine? Pretty much. I mean, I know there are some exceptions, but
Right. So none of us are surgeons, but if you think about your cardiologist, your pulmonologist, your nephrologist, kidney
Right,
doctor,
right.
all of those specialists were once internal medicine doctors first. They all had to complete a 3-year internal medicine residency before
Okay.
they went on to their specialty fellowship. So
Okay.
think about endocrine, hematology, oncology, infectious disease, pulmonary.
All of it.
All of those were internal medicine first. And then there's some of them, like me, who stayed general. So I didn't go on to do a specialty fellowship. I stayed in general medicine. So I'm the type of person that hospitalists were first.
okay.
They trained with us and then they stayed in the hospital. Most primary care doctors that aren't family medicine are internal medicine. So we do primary care, we do hospital care, or we go on to specialize in other
So
specialties.
basically, you're the foundation.
I like to think so.
I mean, that's how I'm interpreting that. So you're the foundation, and then you build, specialties build upon that.
Correct.
Okay. So let's say that I don't have a physician, and I know that I maybe have some adult whatever. How can I come to y'all?
Absolutely, yes. So I would strongly recommend, if you need a primary care physician, you're going to be looking either for a family practice doctor or an internal medicine doctor.
So how would I do? Do I need a referral? How
Nope.
would I do that? What about insurance?
So some insurance companies require referrals when you see specialists, but no one requires a referral to see a primary care doctor.
I love that.
Now, depending on your insurance, we have to be within your network, which we
Okay.
are within, our practice is within pretty much everyone's network.
Okay.
So, but yeah, you just
Okay.
call us up and make an appointment.
So if I'm having a problem with my stomach, it's really bothering me, or let's say I have, you know, in our age group, maybe some dizzy spells, or my balance is a little off, something just isn't right.
Mm-hmm.
You know, and for women as we get older, urinary tract infections, just, I mean, all of those kind of things that are relative to people that we kind of gear to 50 and up, although we have a lot of young people too, then I can just, where are you located? How do I get to you?
So we are located on the Baptist South campus.
Okay.
So we're on the boulevard, the Southern Boulevard.
Okay.
Our exact address is 2055 East South Boulevard, and
Okay.
we're Suite 201. So we're on the second floor of the building that's called Morrow Tower.
Okay. And then we'll put this up on the screen for everybody, but there's a website or a phone number or...
There is. If I don't
That's
really
okay.
remember
We'll put that up.
URLs at all, but if you just Google
Okay.
UAB internal medicine,
Okay.
you'll find UAB Montgomery. Excuse me, UAB Montgomery internal medicine. You will find us. That
I love that. I love it. We're going to talk more about this, and when we come back next week, thank you, because we're going to let you know more. We've got something for you and a place for you to go. And Dr. Halanych, thank you so much. Thank you for taking your time to come.
You're very welcome.
Thank you for being with us, and we'll be right back.